Stroke is the third leading cause of death. It can even lead to a variety of physical and mental disabilities. 60-year-old S.K. Agarwal, a retired man from Jaipur, suffered the same. He started experiencing some minor signs of paralysis. When he approached the doctors, they suggested carotid stenting for him. He was operated and discharged the next day and is now leading a healthy life.
एक रोज़ मैं खाना खाने के लिए जा रहा था तो फ्रिज से सब्जी की कटोरी निकाल के जा रहा था तो कटोरी हाथ से छूट गई। मैंने सोचा कि कोई ऐसा ही इंसान हुआ होगा जो गिर गई। फिर करीबन 2-4-5 दिन बाद में फिर ऐसे ही दोबारा मतलब कटोरी गिर गई। तो मैं कि ये ऐसा क्यों हो रहा है बार बार। तो मैं कि ठीक है अपन डॉक्टर से दिखाएंगे कि मतलब कि ऐसी प्रॉब्लम है ये और क्या कारण है इसका। अच्छा फिर थोड़ा सा मेरा बोलने में भी है ना एक्सप्लेन जीभ है ना सब नहीं चल रही थी, उछल नहीं रही थी।
Carotid stenting is a method to open the blocked arteries and improve the blood flow to the brain and prevent a brain stroke.
It is done under local anesthesia. It is done in the angiography lab where you pass a tube called a catheter into the beginning of the arteries which come out from the heart. These are the carotid arteries. And then the only difference here is that unlike the heart angioplasty, we use a special umbrella which is like a filter so that any cholesterol pieces which break during the ballooning and stenting procedure will not travel into the brain and cause an attack, but they will get caught in this filter. So this is called a distal protection device which traps all the debris which is breaking during the procedure, and once the procedure is over, the umbrella is closed, capturing all this debris, and it's removed from the body.
But the procedure depends on the degree of blockage. It is meant for patients with symptomatic carotid artery disease with risk of more than 70% and having the symptoms of a mini stroke.
The other alternative way of treating, that is carotid endarterectomy surgery, has also no safety advantage over a carotid stenting procedure. So both have been compared and we have found that carotid stenting is as safe as carotid endarterectomy procedure and far less invasive because you can be out in 2 days without complications of cutting nerves and other things. And if we do not do this procedure and just keep the patient on blood thinners and cholesterol medicines, then they are at a risk of, let's say, 20 to 30% of having a stroke, a full-blown stroke in the next 1 year.
Until recently, traditional open surgical procedure known as carotid endarterectomy was the only acceptable surgical method for correcting a blockage. But with less pain, smaller incision and shorter hospital stay, carotid stenting has become the most recommended method, which takes about 1 to 2 hours normally. CVB News, Delhi.